You won't believe it, but I'm 53 years old. Thanks for inviting me to Health Longevity, and today I want to share something every senior needs to hear. Most people think health checkups are always a good thing. But what if I told you that, after a certain age, some of them could quietly put your life at risk? I know that sounds surprising, but more and more experienced doctors are stepping forward to say it's true, especially when working with patients over 70. You see, not all medical screenings are harmless, and some of the most common ones could lead to unnecessary procedures, stress, or even complications that harm your quality of life. In this video, we're going to talk about 5 medical tests you may want to avoid after 70 and what's smarter, safer options you should consider instead. So make sure to watch this all the way through. It might just save you from a serious medical mistake. Let's begin with mistake number 1, the colonoscopy trap. Colonoscopy has long been seen as a life-saving tool in the fight against colon cancer. But after age 70, the story changes. Especially for those without symptoms or family history, colonoscopy can quietly become more dangerous than helpful. Why? Because the procedure is intense, even for younger adults. It requires heavy bowel cleansing, sedation, and inserting a scope deep into the body. For seniors, this can lead to dehydration, electrolyte imbalances, and lingering side effects from anesthesia, like confusion, dizziness, or even falls. Worse, many older adults end up facing unnecessary follow-up surgeries after polyps are found, polyps that may never have caused harm in the first place. Let me be clear. These growths often take 10 to 15 years to turn into anything serious. And if you're 75 or 80, that timeline may not matter anymore. Yet fear kicks in, and suddenly you're in a cycle of tests, biopsies, and surgeries, not because you're sick, but because the system says just in case. But there's a smarter way. Today, there are non-invasive stool tests that offer safer and effective screening without the risks of colonoscopy. If you've had clear results in the past and have no symptoms now, it's absolutely reasonable to say no to further colonoscopies. You're not ignoring your health. You're protecting it wisely and with intention. Mistake 2, the full body scan mistake. There's something tempting about the idea of getting a full body scan. The thought of catching every little issue before it becomes a problem feels like smart prevention. But after 70, it's often a dangerous illusion. Full body scans, especially CTs or MRIs, are powerful machines that pick up everything, including harmless abnormalities. These tiny findings, often called incidentalomas, can send seniors into a whirlwind of fear, follow-up appointments, biopsies, and even unnecessary surgeries. And here's what most people don't realize. These small abnormalities may never affect your health at all, but once they're found, doctors are trained to investigate them. And that's where the trouble begins. For older adults, even a simple biopsy can lead to complications, infections, bleeding, or long recovery times. Sedation and contrast dyes can affect kidneys, especially when they're already weakened by age. Let me tell you about Betty, a 78-year-old who got a discounted full-body scan at a health fair. The scan found a tiny lesion on her kidney. It wasn't causing symptoms and likely never would. But fear took over. Within weeks, she had surgery. She spent months recovering. Her energy never returned to what it was before, all because of something that never needed fixing. The lesson? If you feel well and your doctor hasn't found anything concerning based on symptoms or physical exams, you probably don't need a full body scan, especially not just in case. After 70, peace of mind doesn't come from more testing. It comes from trusting your body and choosing wisely. Mistake 3, the annual treadmill stress test. For decades, the treadmill stress test has been a go-to screening tool to check for heart disease. But here's the truth, after 70, it often does more harm than good. Here's why. Aging naturally changes the heart and blood vessels. Arteries stiffen. Electrical patterns shift. These changes can look suspicious on a stress test, even if you're perfectly healthy. Doctors call these false positives. They lead to more tests, like angiograms or catheterizations, and sometimes even unnecessary stents or surgeries. These procedures are invasive and carry serious risks: bleeding, infections, kidney damage, and complications from anesthesia. Let me tell you about Harold, a 76-year-old grandfather. He felt fine, walked every day, had no chest pain or fatigue. His doctor ordered a stress test just to be cautious. The result was slightly abnormal. That led to a catheterization and a stent. After the procedure, Harold had internal bleeding and spent weeks recovering in the hospital from a problem that wasn't even causing symptoms. That's the danger. If you're not experiencing chest pain, shortness of breath, or unusual fatigue, there is no strong evidence that routine stress tests help you live longer. But there's plenty of evidence they can lead to overtreatment. So, what's the smarter path? Focus on what keeps your heart healthy: daily walks, eating real food, staying socially connected, managing stress. Not machines, not wires, not tests designed for people half your age. After 70, good medicine means thoughtful care, not automatic testing. Mistake 4. The DEXA scan obsession. Osteoporosis is a real concern as we age. And the DEXA scan, a test that measures bone density, is often used to assess risk. But here's the catch. After age 70, this test can lead to fear-driven decisions that don't actually reduce fracture risk and might even cause new problems. Why? Because the scan gives you a number, a score, that compares your bones to a 30-year-old's, not someone your age. So even if your bones are normal for a 75-year-old, the test might label you osteoporotic. That label can lead to medication, often strong drugs like bisphosphonates, which come with side effects like jaw problems, digestive issues, and in rare cases, bone death. The worst part? Many seniors who break a bone never had a low DEXA score to begin with. And many with low scores never break a bone at all. Because bone health is about more than just density. It's about balance, strength, mobility, and environment. If you've fallen before or struggle with balance, those are far more powerful indicators of fracture risk than a single number on a screen. So what should you do? Instead of obsessing over your bone density, focus on staying strong and steady. Gentle resistance training, walking, Tai Chi all build balance and protect your bones naturally. And yes, talk to your doctor if you've had fractures or are at risk. But don't let one test define your path, especially when the treatment may not be worth the risk. Mistake 5. Routine prostate cancer screening with PSA tests. For many older men, getting a PSA test feels like a routine part of staying healthy. But after age 70, especially if you're not experiencing any symptoms, this test might cause more harm than help. Here's why. The PSA test measures levels of prostate-specific antigen in your blood. But high PSA doesn't always mean cancer. It can rise with age, infections, or even after riding a bike. Yet a slightly elevated number often leads to biopsies, and that's where the cascade begins. Prostate biopsies are invasive and carry risks like infection, bleeding, and long-term side effects. Worse, they often uncover slow-growing cancers that never would have affected your health in your lifetime. But the word cancer creates panic. It leads to surgery or radiation, both of which can cause urinary incontinence, erectile dysfunction, and deep emotional distress. What makes it even more frustrating is this. Large studies have shown that PSA screening in older men does not reduce overall mortality. In fact, many professional medical organizations now recommend against routine PSA testing for men over 70 who are not at high risk. So if you're not having urinary symptoms and you've had no prior issues, it's absolutely reasonable to skip this test. Talk to your doctor, weigh your personal risks, and focus on the quality of life you want, not just the numbers on a lab report. Because at this age, living well often means letting go of unnecessary fears and choosing peace of mind over panic-driven medicine. If you've made it this far, you already understand something powerful, that health after 70 isn't about chasing every test, scan, or screening. It's about choosing what truly matters. You've spent a lifetime building wisdom. Now is the time to use it, not to be pushed into medical decisions out of fear, but to step forward with clarity, asking, will this test actually help me live better, or will it just create more stress? Because real wellness after 70 is not about numbers on a chart. It's about your energy, your memory, your mobility, your joy. It's about protecting your independence and living in a way that feels aligned with who you are today, not who you were 30 years ago. Here's what I hope you take away from this video. You're allowed to say no. You are allowed to ask questions. And most of all, you're allowed to make medical decisions that prioritize your peace of mind and daily quality of life. Screenings aren't evil, but they're not always necessary, especially when the risks outweigh the benefits and the benefits are uncertain. So, what's next? Have an open, honest conversation with your doctor. Ask about alternatives. Ask if a test will change your treatment plan or just create more appointments. And if the answer doesn't feel right, trust your instincts. You've earned that right. If this video gave you a new perspective, please share it with a friend who might need it too. And leave a comment below. Which test surprised you most? What change are you going to make after watching? Don't forget to subscribe to Healthy Longevity, because every week we're here with honest, science-based advice to help you stay sharp, strong, and in control of your health for years to come. You deserve care that sees your whole life, not just your lab results. Thanks for watching, and take good care of yourself.